recovery. And with that, my name is Liam Sweeney. I also serve as a Human and Community Services Chair, but I wanted to give the floor to the mayor to give the opening remarks.
Thank you so much, Liam. I apologize if we're sharing space now, and so if something happens, Facebook will see that we're whatever. I want to thank everybody for being here. This was very short notice. I've been thinking a lot since the beginning of our world changing, how much this pandemic has impacted and will impact everyone over time, and in what ways, and profoundly, and sometimes for a very, very, very long time. And how can we, as a caring community, a proactive community, caring community, engage with our very invested public in helping to recover and reopen ultimately in phases over time, and these may be in waves too. There are going to be different needs as things happen. So how, we have a committee structure, as Liam mentioned, he's the chair of our Human Services Committee, where we interact with staff. Very occasionally do we bring in a public about a particular issue, but there's not a good venue to engage the public in a discussion with staff either present or at least connected, and elected officials being engaged in that process to take in ideas. And this was a little hard to gel in our structure. Connecticut has very strict freedom of information requirements, so we have to have formality to our structure. And every time I came up with an idea, I would have a conversation with Corporation Counsel, and I would be like, yeah, that's not going to work. So it's been a frustrating process, but I think we have a model. It's not going to be perfect, but I think we have a model that will allow for community discussion, engagement, with elected officials, also with town staff. And so when I was trying to really sort of enlighten people on what I had in my head, I was thinking that, I actually had a hard time describing all of the pieces and how they could come together from a purely government perspective. And I listened to at Bloomberg, I join in the U.S. Conference for Mayors, host these Bloomberg webinars, and they're very enlightening. They're Thursday, 1:00. They're actually amazing. And several weeks ago, they talked about, there was a session on the government of how governments are set up for probability success and not for possibility governing, and how we structure ourselves to have limited failures, but limited ideas. And we have these very big guardrails up. There's a lot of process, and by the time it gets somewhere, it's really been protected, and it's very oftentimes pretty vanilla when it comes to very peeled off sort of when we get to a place where we're implementing something. And it protects us. It protects government. It protects, management. It protects workers. It also protects elected officials. Probability government is the way we've always functioned. Possibility government's a lot more risky. You're going to have times when you put yourself out there and things don't come together and you have failure, and everything's not going to be perfect. And that in tumultuous times and in challenging times, possibility government is essential. And there's rare opportunities in our lives where we have the ability to really reset and think about the way we do things in a way that is, again, can be transformative. And so that's what this structure, I hope, allows us to do. It's a little more structure than I was hoping to have, but this is the hope, that we are engaging with staff. This is a bit heavy on staff process today because we're backed up a little bit on some particular issues. But going forward, that many of the ideas and the connections that government can make. That's what government can do, is make connections. We can't do everything. We really can't do everything, but we can connect a community group to a community group. We can also get the word out that certain things are happening in our community that will benefit our residents. So those kinds of things we can do. And so again, this one is a little less of that community engagement. We have community members, and I know Lam will introduce everybody. But this is just the ground floor, and I hope this is a launching pad to some great discussions, some great actions, some great plans, some great connections. And I really hope that we can get, even if a few good ideas are just incubated and baked here a little bit, and then are let go, I think we will be a better community to have that engagement. There was something else I was going to say, but I'm not sure what it was. So I would ask for your patience as we figure out this new model and this new all these procedures. But I would say that spin-offs of this group are encouraged. So if we are talking about something and you think, oh, I know somebody that really will be able to help to, answer some of the questions, or he may be a great resource to bounce something off of, and you end up learning things and you have a conversation, do that. Be empowered. Be motivated, be innovative, go do those things, and then bring them back to this committee to then try to flush it out a little bit. Maybe there are things that won't work. Maybe there are things that will work. We always, they did say on the webinar, some ideas will be delusional, and those should be kind of put aside, for maybe another day. But if there is a possibility that something is going to work and it can help even a handful of people, we have to give it a try. So that's my charge. I will say we all need to step in. We all need to do our share. This is a time more than ever where we're dependent on each other. My actions impact you, and your actions impact me. I wear a mask to protect you. You wear a mask to protect me. All of us are impacted in different ways. Without childcare, people can't go to work. People can't, there's all of these pieces that are, without college, kids are derailed, jobs are lost. There's so many challenges right now that we have to face. And we have to help each other to get through this, and to help however we can during this. And I really call it a journey. So with that, I'm going to thank the committee members. I just want to talk about the two committees in the structure for 1 minute. This committee is the Special Advisory Committee on Social and Community Recovery. It's responsible for evaluating quality of life issues, including but not limited to, and that's my echo always, to social needs with regard to physical health, mental well-being, food security, child care and education, technology access, transportation, and at-risk populations. Be responsible for joint deliberation with the Board of Education to consider needs of school-age population. Have general oversight over town departments involved in meeting social and community needs during the pandemic. Review and evaluate recommendations concerning policies that would maintain and improve the high quality of life in West Hartford during the pandemic. Our other committee is on economic and workforce recovery. There will be overlaps in both of these committees, and all counselors and community members are encouraged to participate in both. This is responsible for evaluating the needs of West Hartford's businesses, nonprofits, and workforce as a result of the pandemic, including but not limited to the following industries: restaurants and hospitality, arts and culture, entertainment and leisure services, professional and business services, construction and building trades, property management, transportation services, healthcare services. Have oversight, that's our standing for our standing committees, have oversight over town departments involving delivering services to and assisting West Hartford's businesses, nonprofits, and workforce during the pandemic. And then review and evaluate recommendations concerning policies that would assist in reopening the town's economy, allow businesses and nonprofits to operate in a way that is healthy and safe, including but not limited to recommendations concerning business retention, business resources, occupational safety, and workforce development. And the counselors that are assigned, Liam is chair of this committee, and he formally on this committee are also Carol Blanks and Mary Fay. And on the Deputy Mayor Leon Davidoff is chairing the Economic and Workforce Recovery. Lee Gold, Beth Kerrigan, Ben Winograd, and Chris Williams are on that committee. But again, that's formal. Informally, they're both on. Everybody's on both committees. And with that, one more thing on scheduling. Tonight is a little bit, again, was kind of organized quickly because there's some things happening this weekend and we wanted to be informed and educated on them. And then next week, because of Memorial Day, the economic development, because of the changes with May 20th to today, the reopening of businesses, some things have started. So we're going to have another meeting next week, Wednesday or Thursday. I don't know if Leon's on and he can let me know when that will be. And then we're going to have them on standing Mondays at 6 p.m. every other week. So they'll be predictable. You will know when they are, and we'll go through and have, and if you can participate, great. If you can't, you can always be filled in. Hopefully these will be, you can play them at any time. And again, it's more inclusive, more engagement. The better off we will be. And thank you. With that, we'll close. Again, thanks so much. Liam, back to you.
Thank you, Mayor, for that was a great summary of what we have on our hands here. So with that, I'll just jump right into it. We have a bunch of folks here today, but I really just I would like obviously to acknowledge Councilor Blanks and Councilor Fay, and if Councilor Blanks just want to give a few comments about the work here, as well as Councilor Fay. I'll start with Councilor Blanks.
Thank you, Councilor Sweeney. Hello, everyone, and good evening, and thank you all for willing to participate on this much-needed committee. As we all continue to navigate through these troublesome times, as the mayor pointed out, it's best that we work together and maximize our efforts. We all know that there are many different things that are happening, many different challenges that our community is facing. And as we move towards our warmer months, we also realize that there are going to be many different things that we all need to engage in. And as Councilor Sweeney and the mayor pointed out, as well as my other colleagues, we all bring different talents to the table. And what better time to lend those talents and to expose our skill set than now, to come together and make our community even better than what it is. Many times, great things happen out of challenging events such as we're all experiencing right now. And I'm pleased and proud to be part of this committee, and I just can't wait for all the things that are about to come.
Thank you, Councilor. Councilor Fay?
Yes, good evening, and thank you, Mr. Sweeney, and thank you, Mayor Cantor, and Ms. Blanks as well. You know, when I think about this, the last time I went through some sort of pandemic planning, it was a long time ago, and not that this is just pandemic, but it's certainly a big driver of this. It was the avian flu and it was the bird flu. And we were just coming at it from a business perspective because it was part of my job. So I really appreciate the fact that we're trying to address this on a holistic basis. And we'll be dividing this into bifurcation for resource purposes into the two committees. So I think that's a really, really strong approach. So I'm pleased, very pleased that we're proceeding on these lines. And of course, we can join the other ones, and we're all part of this. We're all in this together. You know, a couple observations. I think, you know, a lot of things have happened, and I'm amazed at how resilient the community has been, as well as the kids. So the kids are out of school. I've got a little one, as you know, and she's bounced and she's doing her work on her computer and she's doing fine. There is a little bit of a social component. So the first thing she said to me when this all got shut down, so to speak, was, I miss my friends. And, there's no softball this year. The softball league was canceled. So I think there's a other component that I'm so glad that we're addressing, which is the social, the mental health, the impact on folks that they may not really realize. So I've got a close watch on what's going on with the kids, and trying to be mindful of that as we think about leisure services. I know Helen's on here. I saw her earlier, and those kind of things. So, we want to try to make things available as best we can, but utmost in safety is our primary motivation and concern. So I think this is good to work together. I'm glad that they're open forums that the community can participate in and bring things forward. And, part of the things that make West Hartford so wonderful and a place to be and a destination is all the wonderful social programs that we have and resources like the library and Parks and Rec and things like that. So the focus on that will be very, very good in addition to the business and economic planning.
Thank you,
Thank
Councilor.
you.
So with that, I'm just going to go in and introduce folks that are here so that we can kind of get right into the business of things. So with us today, we have the Director of Leisure Services, Helen Rubino-Turco. I know, Helen, you also have other members of your staff. When you give your update, if you don't mind just letting us know who is here. We also have Estrella Calderon from Social Services, Martha Church from the library, and as well, Martha, I know you have several members here as well. And we have Amy from the Health District as well. And I'm trying to see who else. Oh, yes. And then we have folks that are going to be here at the end are going to just touch on some of the work that everyone is familiar with, the bridge. We have both Chris Dutton and Jonathan Merritt. Chris interacts mostly with the schools, and Jonathan is in charge of the teen center here in town. And then last but not least, but we have Ari Steinberg from the Board of Ed. Ari has along with being on the Board of Ed, has a substantial background as a clinical psychologist working with both child and adolescents. And I thought that her perspective would be really, really well used here with all of the different touches that we're interacting with here. As the mayor talked about, we have a pretty broad scope of work and a lot of it interacts with one another. So one of the things that we're going to do today is that we're hoping to kind of just run through the steps and procedures and policies that the town has taken in direct response to COVID. I know the town has worked really, really hard to keep in mind that the health and well-being of all of our citizens, and are really trying to make sure that our programming keeps that in mind, and making sure that we're not spreading the virus in town. So it's really important that we hear what they're doing and why they're making these decisions. But also, I think today we want to try to give some input and get some understanding of why these decisions are being made, and how we can work with the community to improve upon that, and also think about ways that, and I think what we're going to do after this is Carol, myself, and Mary will kind of talk about, and consult with the mayor as well, talk about how big this scope of work, and try to organize the next meeting so that they're more comprehensive but organized, right? So these are really big subject matters, and if we don't have a kind of a focus in each of these meetings, we can kind of be going off it's spiraling and not having an as effective meeting. And I want to be respectful of everyone's time, because these are trying times right now, particularly at people's homes who have kids, and I just want to make sure that we're doing the right thing here. So with that, I want to hand it over to Amy Kraus, and just what we're going to be doing is for all of these meetings, we're going to be providing a health update as well, And I also want to make sure that I acknowledge the hard work that of our town manager as well, putting this all together, making these committees possible. So Matt is here as well. But with that, I don't know, Matt, if you have any update that you want to provide, if there is, please do. But if not, we can go right to Amy.
Thank you, Councilor Sweeney. Just a couple of things quickly, if I could. Thank you all for coming together tonight. Two things I'd like to touch on. Number one, I want to thank the mayor for her leadership in putting this group together, as well as all the councilors and community members that plan to participate. We do have a good number of staff on board, and we are genuinely excited to work with you in a collaborative way in this new model. You know, we know that by working together, we can accomplish great things. The second thing I wanted to report on, and it is somewhat bittersweet, but I know she's excited about it. Our longtime library director, Martha Church, who grew up in West Hartford and has had a great career here with our public library. She is retiring after a stellar career, and we are recruiting. The library board is recruiting for her successor now, and I'm pleased that our library board chair, Jill Spear, has also joined us tonight. So Martha has very big shoes to fill. She has a great team. We're confident that with the strength of our library program and the wonderful town of West Hartford, that we'll be able to attract some excellent candidates to fill her position. And we look forward to acknowledging Martha in a more formal and extensive way, I guess in a virtual way, perhaps, at a later point in time. But thank you, Martha, for everything you've done for our community and the West Hartford Public Library. Back to you, Councilor Sweeney.
Absolutely. And just before I hand it over to Amy, I just have one housekeeping thing. Just if you're not speaking, you're on the phone, please just keep your computer or phone on mute. I know everyone's probably heard that a million times these days. So, but thank you, and Amy, the floor is yours.
Sweeney, and thank you, Mayor, and also Town Manager, and also the rest of the council for having me. So as we talk about children, you know, that's one of the topics that I've been focusing on a little bit more. We've been seeing a number of new cases pop up called multisystem inflammatory syndrome in children. Currently, right now, there are 8 children in the state of Connecticut that are being monitored and cared for with this condition. So you might ask, well, what is that condition? How is that different than COVID? And it's got 2 separate case definitions. This particular, what's also known as MIS-C. And so these conditions are different than COVID. Children have diarrhea, vomiting, a rash, some conjunctivitis, swollen hands and feet. They can be irritable, abdominal pain. And so they can also, some of these symptoms can also resemble that of Kawasaki disease and also toxic shock syndrome. So it's very important that if families feel that their children are starting to have signs and symptoms, to immediately contact their pediatrician. So again, we're watching this very closely. A lot of the information that we're seeing is also coming out of New York City. So we at the Health District are participating in weekly calls with the Department of Public Health and are being provided updates on this new emerging condition. Going back a little bit, currently the town of West Hartford has 512 confirmed cases of COVID. There are 87 deaths associated with COVID for West Hartford. The Health District has continued since day one. And when I say day one, meaning we look at it as February 1st. We've been doing contact tracing from the beginning. Currently, the state of Connecticut has released a beta version of a contact tracing program, which we are participating in. But again, we've continued this tracing from the beginning. And what that means is when somebody tests positive for COVID, our public health nurses contact the individual, ask a series of questions, which include, occupation, place of visit. And again, we trace it. We trace to see if there's been any future exposure. We're looking for hot spots as well. Again, the health district has been very busy. We've been working with the town on getting Connecticut reopened. We've participated in, as the town manager has stated, the outdoor dining. We've been very active with that. We currently, as you know, complete restaurant inspections. So this is not something that's new for our inspectors to do. We are focusing on, again, the sanitation, making sure that individuals have face coverings on. We're going over ill food worker policies with our establishment. So those inspections started today. We are also looking at our grocery stores again, and we will be revisiting those to make sure that people are compliant. We have seen a short increased number in cases in West Hartford. I contribute that to our long-term care facilities now are required to be testing all their residents. So we've seen a spike. We've seen some people that are asymptomatic now testing positive. So again, that's why you might see an increase in cases. We are also looking at and supporting the staff being tested as well at these long-term care facilities. Again, I'd be happy to help answer any questions. I wanted to give you an update as far as what the health district is working on. We are putting in requests specifically through the Department of Public Health for thermometers. My goal is to work with the Board of Education and get those thermometers out with the service of food and also for summer camps. Even though right now we've seen originally in the beginning you had a fever, a cough, shortness of breath, a lot of those signs and symptoms have now changed to increase, vomiting and diarrhea, abdominal pain, loss of taste and smell. So the conditions and symptoms that were originally noted were changing. However, again, we still see some individuals that have fevers. So we did make that request for those documents. But again, I'd be happy to answer any additional questions.
Thank you, Amy. I had one question. I think we had talked about this over email, but I know that the state was providing those thermometers to places of worship as well. I don't know if Matt, do you have an update in regards to how that's going right now in town?
Matt Hart, Town Manager. I can start, Counselor, and then Amy can add to my comments. So we have established a very successful PPE distribution center at our Brixton Street, our Public Works facility, and we're serving a large number of different sectors, both in the for-profit and the nonprofit world, on almost a daily basis. The supply is coming in from the state or for the capital region, and then we've been coordinating with the National Guard, the Health District, and others to distribute those items. With respect to the specifics related to the houses of worship, I don't know the answer as to when they were able to obtain the most recent allocation of PPE. If Amy does not have that answer, we'd be happy to follow up with you. But I do know our Brixton Street facility has proven to be very successful and has been highlighted as a model for the capital region. I would ask that if we turn to Amy briefly.
Go ahead, Amy.
Yep, thank you. Amy Kraus. Yes, as Matt says, the health district is participating regionally in receiving personal protective equipment. We are notified on Monday and Tuesday where that allocation will be going. We don't know until roughly around Tuesday what the town is receiving. It is received on Wednesday through the RDS, the distribution site. Then on Thursday, it is broken apart. And then again on Friday, the allocation is picked up. This week specifically, we had PPE delivered to dental offices, urgent care facilities. Next week, again, I'm not sure where the allocation will go or what it will be, but we continue to participate. Obviously, our site is specific for Hartford and Windsor, so we split our PPE with those two towns. And then again, who receives it's all determined by the state and the need.
Great, thank you. Anyone have any questions? Councilor Winograd, before you go, I just want to acknowledge the fact that Councilor Winograd is with us, as is Councilor Davidoff, Councilor Gold, and Councilor Williams is in here, and as well as Councilor Kerrigan as well. So just wanted to get that housekeeping. The floor is yours.
Thank you, Councilor Sweeney. Ben Winograd, Town Council. Just a quick question. As we start to reopen in the center, I understand there's lots of sort of directions coming in for the restaurants, but I'm wondering about sort of masks in general. And right now, if you go through the center, most people are not wearing masks, but it's one thing walking around your block and something else walking through what will hopefully become more crowded streets. I'm wondering whether or not sort of a mask policy for pedestrians in the center is within your authority, or whether that's something we can get your opinion on. Thank you.
Thank you, Amy Kraus. Currently, right now, the guidance through the governor's office and the CDC is to wear a face covering when out in public. I cannot make individuals wear face masks. Individuals under the age of 2 or that have a medical condition are not asked if they had a medical condition, but they're also not required to wear a face mask due to that medical condition. So currently, right now, yes, you should be wearing a mask if you are able to and do not have a medical condition. It not only protects you, the person that's wearing the mask, but the person that you might encounter. It's to protect both of you. So if you are able to, I would highly recommend that you do wear a face covering when you are out in public or are walking and you might stop and meet somebody that you might know. You should have that mask available so you can put that mask or that face covering on. Again, it's to protect you and it's to protect the other person. So yes, I would recommend it. I just can't require it, again, for the medical reasons.
Thank you.
Thank you. Thank you, Madam Mayor.
Yes, I think we have discussed this in public safety, and I think this is a discussion that's going to happen in both committees, and it'd be extensive and ongoing about wearing of face coverings. Matt, would you just like to share what we have talked about and what the limits of what we can do, but what we are doing and what we expect in the center?
I'd be happy to do that, Mayor. Matt Hart, Town Manager, and actually just got a more specific answer to Councilor Sweeney's earlier question. Bob McHugh, our recovery coordinator, is listening in and has told me that tomorrow we will distribute 114 thermometers to houses of worship and various businesses at our Sedgwick Middle School distribution site. So we have both Bristow and Sedgwick. With respect to face coverings, as the mayor said, it's been a topic of some considerable discussion. What we are planning to do as more people begin to return to the center is we're going to continue our communication program through the town, particularly relying on social media. And that's been a great team effort between our public information officer, Renee McHugh, and Martha Church and the library staff. So we're going to continue to communicate about the importance of wearing face coverings. Our police will have an increased presence downtown and are reminding people of the importance of wearing a face covering. In addition, with respect to enforcing the other requirements set out in the governor's executive order, the health district will be responsible for all food establishments. So the health district will take the lead there, and our zoning enforcement office is responsible for all of the other retail establishments. So the police will work closely with both the health district and the zoning office. We have talked a little bit about a West Hartford specific order that would require people to wear face coverings in town center and similar locations. We're uncertain right now whether legally that would be the best move. However, we're going to continue to communicate the message and engage in enforcement. We're also going to look to erect additional signage to alert people to the fact that they should be wearing face coverings as well as complying with physical distancing, et cetera. So I'm sorry for that long-winded answer. Hopefully that was helpful.
Thank you, Matt. That's very helpful and great. Mayor, do you have a follow-up? Okay. And Councilor Fay had a question.
Yes, this is directed to Ms. Kraus. I guess this new sort of symptom things that are happening with children, I don't know too much about it. I think you mentioned that there were 15 kids in the state that have contracted. I forget what it's called. But are there fatalities, and can that be fatal as the normal COVID-19 virus is?
Thank you, Amy Kraus. So currently, so there are right now in Connecticut, the information that I've received from the Department of Public Health is that there are 8 children that are being monitored for it's called the multi-system inflammatory syndrome in children. So MIS-C is the abbreviated term. So right now, that I am not aware of any children in Connecticut that have died of this condition. There are children, again, that have underlying medical conditions that are affected more so than a child that does not. Again, what parents can do is limit exposure from children to other children that might be sick, to increase hand washing. If the child is able to wear a face covering, that they should do so. Again, if they don't need to go to a grocery store with you, then they should stay home. You want to, again, continue to limit their exposure of this new emerging condition. So again, the best way is to physically distance yourself from other outside individuals. I'm not about specific family, but again, it's friends, neighbors, because you don't know where they've been. You don't know where they've been exposed. You don't know if they are asymptomatic. So again, the concern is that this is a new way that we need to start looking at how we're going to do things differently. So I hope that answers your question. And what I can do is the Department of Public Health has put out a fact sheet from New York City. And what I could do is send that out to the group so you have that informational sheet.
Very good. Thank you.
All right. Any other questions for Amy? Seeing none, we will move on to programming updates and hand the floor over to Ms. Rubino Turk.
Thank you. This is Helen Rubino Turco, Director of Leisure Services and Social Services. So first we'll talk about the leisure services side, and later we'll get to the social services side. So the first subject is pools. When COVID-19 arrived in Connecticut, we had significant concerns, public health concerns about operating our summer pools. And as you know, the state has closed them at the current time, and they're going to reevaluate them on June 20th. We received those guidelines yesterday. So this is something that we can discuss at a later time, perhaps in 2 weeks when this committee reconvenes. But obviously, we would love to operate our outdoor pools, but even if we were able to open them, we continue to have significant public health concerns, and we certainly rely on our health director for guidance there. We're also advised by Amy Kraus that the health district lumps splash pads in with pools. So again, we have concerns about crowding, multiple touch points. And so we also are monitoring that situation. They are prohibited for the time being. It's disappointing because usually we open our splash pads Memorial Day weekend. So this coming weekend, we would be opening them in 4 locations in our town. So because they're prohibited, we will be developing a message about pools and splash pads within our department, but also with information from the health district, and we will get them up. But we just wanted you to be aware. At this point, they're not allowed. They're not on the list of recreational facilities that are allowed to be opened. So we would like to revisit that and come up with some scenarios of if you decide that they should be opened. We would need 2 to 3 weeks to open them. We would need to increase the staff that we usually have to run them because we would have to do crowd control, and we would need the funding. So those are factors that we can discuss in the future. The next, does anybody have any questions about pools? The next subject about leisure services activities is summer camps. And this is a big issue. We are a very popular source for recreation activities, but also for childcare in the summer. And we don't know whether people are signing up for childcare or whether they're signing up for recreation, but we typically will have 265 to 270 kids per week in our various programs. So summer camps have been an evolving situation, just like pools have kind of been an evolving situation. We monitor what the State Department, the Office of Early Education, Early Childhood, and as well as federal recommendations. We also monitor and are in constant communication with the Connecticut Recreation and Parks Association, the CRPA. They've done a wonderful job kind of gathering all the information that comes in from the OEC, from the state, for announcements, prohibitions, and they kind of simmer it down to the brass tacks, and they've been a great source of information for us. So we also rely on them. Basically, there are 3, when we're discussing summer camps, there are 3 kind of things that I'd like to say. One is that there are some camps that the OEC has prohibited. We can't offer them. These are half-day camps that are specialty camps that don't offer a lunch. So a soccer camp from 9 to 12 is not allowed. Those are clear. We can't offer them. They're prohibited. There are others that we can't offer as advertised. And I'll use the Funtastic camp as an example. Funtastic is a wonderful camp. It's our bread and butter camp, but its description includes swim lessons and pool time. So we can't offer it as advertised. And our staff felt it was better to just cancel the camp and come up with some alternatives than to try and explain, well, we can offer this camp, but we'll have to give you probably a rebate on something. Do you still want to do it if this isn't included, blah, blah. So we just figured, let's cancel that camp, offer full refunds, and consider some alternatives. The third category of camps is ones that we can modify to fit the regulations. And right now we have Elmwood Community Center is fully ready to offer a modified camp for 60 children, and Westmore Park can modify their program to manage 30 children. So I just wanted to touch on some of the rules that the OEC has given in case you haven't been monitoring them the way we have. There's the 10-30 rule. That is 10 children in a pod, maximum of 30. So we can operate with 10 groups, 3 groups of 10, basically, in any physical area, but they have to be separated. So for example, at Westmore Park, it's a little bit easier to do that because it's such a big space. But keep in mind, for any camp, we need to have restrooms and we need to have emergency shelter. So at Westmore Park, we have 2 rooms that 10 children can go in, plus the barn. So there's 3 areas. We can accommodate that. At Elmwood Community Center, we're actually going to apply for a waiver so that we can have more camps there. But Jamie, who is Jamie Krajewski, is our Elmwood Community Center director, and she's on the phone. And a little bit later, she'll talk about some of their modifications that she's made so that she can have her camp offered at Elmwood, some of her programs offered at Elmwood. Another option in this modified area is some plans that we're working on that involve other options, other sites. For example, school-based sites. And welcome to the Leisure Services roller coaster. At first, we were told you can't have schools. Then we were told, okay, we can give you some schools. Then we were told, no, you can't have any schools. Then we were told, okay, we can give you some schools. So we've been pivoting. If we have schools, this is what we might do. If we can't have schools, we don't really know what we can do. But in the spirit of, yes, we can, and in the spirit of we are problem solvers, we do have some ideas that we will continue to work on and unfold. But there are pros and cons for opening camps and not opening camps. One of the things we, of course, do is what else are people doing in the state? What are our peer communities doing, and what are other communities doing in the state? We know that Manchester, Newington, Rocky Hill, Wethersfield, and Berlin have all canceled their camps. No camps in those towns. Manchester, Newington, Rocky Hill, Wethersfield, Berlin. Others are trying something. They're trying full-day camps, but not half-day camps, or they're extending their half-day camps and including a lunch of some kind. But you have to, there are extra cleaning protocols, there are consent forms, there are daily temperature checks, there are safe rooms for sick children, there are masks that have to be worn by all counselors, but not campers. So there's a variety of rules that are associated, all of which we could live with in some situations. The question is, should we? We've also received an email from Rich Maybe, who has been running one of the camp leaders for the last 30 years. And his question, he sent us a 2-page email about how much he wishes he could, but what his concerns are. And he says, why, if the NBA and the Major League Baseball and they're all shutting down and they're not offering, they're all curtailing and no groups, why would we put our 6 to 11-year-olds and our high school and college counselors on the front line of the pandemic to see if it's okay? Why would we risk that? And so we also hear that side of the argument. We hear the side of the argument of the parents on my street certainly saying, I'm sick of my kids, can you please have summer camp? To, why, is squeezing the lemon worth the juice? So no matter how you slice it, there's a risk. Some risks, there's a risk getting out of bed in the morning, right? But should we take that risk? And that's something that we look to, again, to our health director for guidance and to our town councilors for guidance. So we would really like you to think about our challenge when it comes to summer camps. We certainly have discussed virtual options, but we also, to be very fair, know that putting a kid in front of a screen for 20 or 30 or 40 hours a week isn't a great idea. So we can do some enrichment programs virtually, but we can't offer daycare virtually. And those are, kind of our arguments in the summer camp arena. Jamie, I would like to ask Jamie Krajewski and Mark Blanchard if they have any comments on this, but specifically right now, Jamie Krajewski, the director of Elma Community Center, about the challenges that she's had in trying to retrofit some of her programs, her decision to jettison some part-time programs in favor of full-day programs, and some of the challenges that she's facing. So this is through you, Chairman Sweeney, Jamie Krajewski.
Thank you, Helen. Jamie Krajewski, Director at ECC. I think one of the things that we've been challenged with is, trying to determine how we can, provide not only a childcare option solution for the families in West Hartford, but also I think that social component that I think is so important. And I think Mary had mentioned earlier, I think I'm a parent to 3 children myself, and I certainly think that it's something that we're all seeing in our children that need to be around others and interacting. So at ECC, kind of looking at our building structure and following the guidelines, determining what the best way to not only meet those guidelines, but also to do so in a way that we can provide an atmosphere for the children that, is fun and, and safe. So with that being said, some of the things that we would be implementing at ECC would be providing 2 full-day options. One option for our 3 to 5-year-old population, that's called our Busy Bees care, and we'd have another option for our 6 to 12-year-old population. We would be implementing valet drop-off and pickup to limit the parents and guardians' interactions and need to come into the building. During that drop-off time, there'd be temperature checks, of course, and immediately upon entering the building, all children would do hand washing, kind of in hoping that we can kind of start the day from a place of neutral and clean. The 6 to 12 aged campers would be on one floor and would use a separate stairwell. So there would be no interaction between each group of 10 and also with the other 3 to 5-year-old camp. So each of those camps would remain separate at all times, and then each of those groups of 10 would remain separate at all times. Each group of 10 would have 2 dedicated counselors that would stay with that group throughout the duration of each day and also each session of camp. There would be no crossing or switching from counselors, within groups or pods. Obviously maintaining sanitation and disinfection with high-touch surfaces, having staff using gloves and hand sanitizer. The bathrooms are certainly one of the things that we're, really being diligent about working through the process of how we can continually be cleaning those. And that also kind of came into play when we were determining the number of kids that we felt we could safely meet the guidelines for at our facility in a way that I feel comfortable that I can provide, adequate cleaning in between each group using the bathrooms and the water fountains and those sorts of things. So, Helen, was there anything else that you had wanted me to touch on specifically, or I'm happy to take any questions.
No, that was it, Jamie. Thank you. So again,
If you do you want to just pause there and just kind of open it up for questions, unless you have some more parts on the camp, Helen?
no, I'd be happy to answer questions.
Okay. Go with Councilor Williams, Councilor Blanks, and then Ari.
Thank you, Liam. Helen and Jamie, I just want to say kudos to both of you guys for thinking about the camp program, given the limitations provided by the state, and sort of trying to move forward with it. I know, Helen, you mentioned other municipalities who have just canceled it off the bat, and I think that's the wrong call. You also asked for some guidance. From my perspective, I would really like to see camps move forward. And one of the data points that I think is being lost in the state is that we've had a lot of daycares open over the last 60 days or so of children who are the childs of the people on the front lines, the essential workers. And we haven't seen outbreaks from those groups. Now, they've been kept to groups of 10, but they're children. And if you've been to a daycare, you know that everyone's got something in their mouth at some point in time. And it's hard to keep them isolated. So with that background in mind, and the idea that Governor Lamont, today issued what phase 2 might look like, which hopefully is 30 days from now, a little bit more indoor dining, what have you. I think by you guys setting this framework up now and thinking about how you can provide daycare, I think 30 days from now, you're going to look like you really got ahead of this, and you'll be able to facilitate it. I mean, obviously things are subject to change, but I just want to say kudos to you both. So thank you.
Councilor Blanks.
Thank you, Councilor Sweeney, through you, Councilor Sweeney. And I just want to echo Councilor Williams in terms of the hard work that both of you, Ms. Rubino Turco, and your staff has done in putting this together, because it's clear, it's crystal clear that you have put in a lot of work in terms of how to coordinate this and looking at the safety of the children, as well as making it fun and listening to our residents and our neighbors, especially the parents who are saying, okay, I'm trying to do it all here, but they really need to get back to some socialization. And I am pleased to hear that we are moving forward with the camps. I'm just really interested in really seeing how it's really going to roll out once those little people actually get into your care and begin those activities. I know it's going to be challenging, but I know you all are very well up to the task. So just one question I have for you, Jamie. You mentioned the valet drop-off and pickup, and I'm hoping that you have given some thought to those parents and guardians who perhaps would have to walk up if they're taking the bus, or if they're in the neighborhood and they're going to walk to the facility. Can you just elaborate on that piece, please?
Certainly. So, that is certainly something that we've considered. And really, when we talk about valet drop-off, it's really just an effort to have separate locations at the facility. At ECC, we're lucky in that we have 2 kind of circular areas in our driveway. So we'd be able to take the 3 to 5-year-old campers and have their drop-off in one of those circular areas, and then the older children drop off would be in a separate area. So certainly, we have some campers who come by bus or who walk to camp, and that's not a problem at all. We would just really be asking that they drop off in that designated area so that we can appropriately move the children to their pods without interaction with any of the other children or families. And the main thing that we're trying to do again is to limit the adults interaction with other people's children, and also adults with adults. So, you know, the less people we can have in the building, the safer I think we can make it for those children. And really, you know, ECC is really going to be by doing it this way, I think it gives us a little bit more control over, you know, who is in and out of that building. So that's kind of the thought process there, but certainly, you know, it does not necessarily have to be a car drop off. It's really just an area that we're designating so that we can keep the children separate and get them into their pods without interaction.
Thank you.
All right.
Thank you, Councilor Sweeney. I don't want to be the Debbie Downer on this call, but I just wanted to kind of have a follow-up question while I respect the need for parents to get back to work and the necessity of childcare, as well as, you know, kids getting back to some sense of normalcy and socialization. I actually work in a group-based outpatient program, and I can tell you that before the school shut down and when we were in the midst of this social distancing, you know, we were really implementing social distancing within our program confine, but children and adolescents could not social distance, no matter what we put in place. And we're at a point where we're, you know, being asked to bring our kids back in. And that's really the question of, you know, you can put the best plan in place and put all of those safety plans in place. But what I guess I'm just wondering, so we go for it, we start camp, and then you guys find that you are not able to kind of really provide the safe environment, just because of the nature of children and adolescents. What would be the response?
Yeah, Helen, go for it.
This is Helen Rubino Turco, Director of Leisure Services and Social Services. Thank you, Ari, for that, Steinberg, for that question about safety and what would we do. So we certainly have, with the help of the health district, we have certain protocols that if someone tests positive, that pod goes down for 14 days. The counselors from that pod go down for 14 days. But by keeping the pods separate within that group of 30, means the other two pods can potentially continue, depending on whatever the health district's you know, analysis of the program is. But as I said, this is risky. There's no doubt about it. But could we learn, you know, if we decide to go forward, and we've heard from two counselors that they would be in favor of moving forward. The question is, what can we learn from this? What can we do in our pods of 10 and groups of 30? Can we learn and then share with the Board of Education so that they can see, well, okay, in these situations it was safe, and in these situations it was there were problems, potential problems. So in some ways, you know, going back to Rich Mabey's comment about why are we putting them at the front line, you know, we are putting them at the front line, but we also are going through all of the safety protocols, probably more safety protocols than if they were just riding up and down the street on their bikes with their friends. So in some ways, and we're offering childcare, which parents desperately need. That being said, you know, with the general, you know, comments that I've heard so far, which are, you know, a little on both sides, one of the options that we are investigating with the help of the Board of Education to give us the locations would be, for example, an elementary school where there were 3 classrooms on a wing, and each classroom had its own door to the exterior, and each classroom had its own restroom. Okay, we have public schools that look like that. Well, we could have 3 pods of 10 in that school, two could be outside in different locations, and one could be in their room, or one per day could use the interior gym, and then it could be cleaned, and the next day another pod gets to go into that gym. So we're thinking through all of these scenarios because we do understand the challenge the parents have, and we also want to be a solution-oriented group of people rather than this is the way we've always done it, or that's too risky. But I have to be very honest. We also hear that this is risky. And so this is why we are, this is a subject that we care deeply about, but we also care for your opinions deeply about, and certainly from Amy Kraus and our colleagues at the Health District.
I mean, that's a great point, Helen. I think where this group, this task force can basically go is kind of bring folks that are currently looking at this, whether it just be the town, but also some of the private groups, and kind of just talk about it in a comprehensive and cooperative conversation to see what is working. And to your point, Helen, I think in many others, we're going to see a lot of stuff. The expression I've been using that the council has been hearing all the time is, we're building this plan as we fly it, and we're going to see these things kind of work out right in front of us. So I think this is a great topic for us to have an entire meeting on. And so I kind of just want to move on because you have a whole bunch of other stuff. I do have just two quick questions on this so that we can move on. You said that in regards to the usage of schools, what is it the state is prohibiting us from using schools? Is it the Board of Ed? I just want to be clear on that. And then the other thing is, I've heard also about this lunch requirement for camps. Do we have a reason? What is the reason being provided to us on that? There's lots of different things I could think of, but I just don't really fully understand it. And then lastly, if we do have some really good thoughts, I think that after some of these conversations, I think we really need to involve our state delegation, right, to bring these things to the governor, and really, they're going to come back in a couple of weeks, maybe a month, whatever they're looking at, but they have to come back in to address the budget. And in there, they're going to have to make some changes, and they're going to have some conversations. And I know that in other parts, some of these executive orders have been asked by the legislature. So, I feel like we have such we have a powerful group of people here today, and then we should continue to use that to advocate at another level to see if we see something that doesn't quite make sense. Let's bring it to the next level. But Helen, I will if you could answer those questions for me, thanks.
Certainly. So the use of the schools, we have received the permission from the Board of Education. So that was the roller coaster I was talking about, where them also going through their own machinations of, well, if it's not safe to offer summer school, why would it be okay to offer summer camp in our facility? They're also very concerned about retrofitting and fixing and arranging their schools so that they will be ready in late August or early September to receive students in. So they need to have access to their schools to make those modifications. We said we were super flexible. We could do 1 week here, 1 week there. We could do 2 weeks here. We could 3 weeks here and 3 weeks there. We said we could do, we were flexible. But they have said that they would identify some schools and some specific areas that we could consider using. But again, just because we can doesn't mean we should. And that's something that we would like, more from you. The second question was about lunch. And the definition of a half-day camp and a full-day camp are very clear in the state from the state level. We as municipalities are not. We don't have to go through licensing, but during COVID-19, we follow the guidelines that the state OEC is giving for camp operations. And I'm just going to ask Jamie, if possible, to comment on the lunch component and why that makes a half-day camp a full-day camp.
Sure. Jamie Krajewski, Elmwood Community Center. Liam, I think that when they made that determination, I think from the state level, the way I understand it is that they are looking to provide kind of more of the full day care option as opposed to a program. So if you're having a 3-hour program in, let's say 9 a.m. to 12 p.m., which is a standard half day program, those are typically enrichment programs. So you might have, a soccer clinic or an art class or something to that effect. And I think the state is really trying to push the camp options towards a viable childcare solution for parents as opposed to programming. So if the program is 3 hours or less, the state looks at that and it would fall under the executive order with the limitations on no more than 5 people, including the instructor, and everyone would have to wear a mask, including the children. They have to maintain the 6 feet of distance. So I think that's the determination and the difference between that's that lunch piece, is they consider it to be, if there's a meal break, the Office of Early Childhood considers that to be long enough of a program to need a meal break to be considered childcare.
So it's not that the camp has to provide lunch, it's that.
No, sorry. So no, the camp does not, we don't provide lunch now. And it does not mean that we would have to provide the lunch. We have to provide the time period for the children to eat a meal. And it doesn't necessarily have to be a lunch. It could be a breakfast.
Gotcha. All right, cool. That was, I just wanted some clarity on that. All right, with that, go ahead, Helen.
You had a third question, and that was about our state delegation. And I'm not sure that we get very clear guidelines from Office of Early Childhood and the state and through CRPA. Other than, there are other things that we would probably look to them for clarification about camps and the rules to operate camps. Again, we are very committed to making sure with our partners in the health district that we have clear protocols about, regardless of what the state says, that we can operate them safely. And I'll use the example of, and I know we're going to get to this in a minute, about opening up our recreational facilities. Just because we could open golf didn't mean we did open golf. We waited until we were sure that we could operate it in a safe manner. And I think the same thing, with Amy Krause's help, we would be able to do that regarding our camps in West Hartford. Thank you.
Oh, great. Thank you for that. So with that, why don't we move to your next item, unless there's any other questions? Looking once. Okay. So senior programming.
This is Helen Rubino Turco. I did see Mr. Winograd had his hand up. I don't know if you wanted to.
Hi, Ben. Yeah, fire away.
Ben Winograd, Town Councilor. Thank you, Helen, for noticing me. It was a half wave. So just a question. A lot of employers sort of realized early on in this that the lack of paid sick days can result in sort of wrong behavior from employees. In other words, you want people to have some assurance that if they say, hey, listen, I'm not feeling great today, that they will stay home. Others were furloughing people and giving them, paid time off to encourage people to honestly report their condition. And that's certainly been coming up, I think, in some places. So with a, large, part-time staff, you want people to, again, if there's any question at all, they should be coming to work. They should be not coming to work. Has there been any discussion of how we can make that sort of easier for people, especially young people? They may be a little reluctant to admit that there's a reason for them not to come to work one day.
with Chairman Sweeney's permission, this is Helen Rubino Turco, Director of Leisure Services and Social Services. Mr. Winograd, you asked about paid sick leave, and I don't know. I know the town has a policy that we don't do that for part-time. Certainly for seasonal employees, for full-time, year-round part-time employees who have worked for us for a number of hours or years, they do have paid sick leave, part-timers, but our seasonal staff, it's not something that's extended. So that would be something we would need to request through our HR department. But we would require, as Amy Kraus could probably confirm, that we would require daily temperature checks for all the staff as well as all of the campers. So hopefully that would at least be a stopgap, if you will, to eliminate people coming to work who might be sick. If that answers your question.
You're muted, Ben.
That's sufficient. Thank you.
All right. I will try again to see if any other questions for Helen on the camps. All right. Moving on to senior programming.
So again, this is Helen Rubino Turco, Director of Social Services and Leisure Services. I am delighted to have Gina Marino with us, and she is the Director of the West Hartford Senior Center. And the two senior centers that on the north side of town, the West Hartford Senior Center is located in Bishop's Corner, as you know, and the Elmwood Senior Center is located in Elmwood Community Center, and both senior centers are closed. This is a vulnerable population. We care a lot about keeping them engaged, but not together. And so Gina and Kathleen Ferroni have been doing a wonderful job staying in touch with their membership and also with some virtual programming. So I wanted Gina to talk about what they have been doing for their community.
No?
You're good. Gina, you're muted again. There you go.
Okay, I won't touch it. Kathleen and I and Lisa Hans have been working very closely together, offering as many virtual programs as we could. We're doing different kinds of educational, line dancing, a little bit, whatever instructor would volunteer and was willing to do it, we've been able to do it. It doesn't help the people that don't have computers, unfortunately. But we've been making phone calls to those seniors that aren't connected with a computer, that don't have the technology. And we've also been sending, putting out press releases, and we're working hopefully to get something on the local cable station so that we can get some of our classes on there so that people can participate in their cheer yoga that they've been missing. We've helped with the mask program. The senior center started getting some masks donated, and we were able to help with the class program and the masks, and that's been successful. It has been a challenge because many of our seniors don't have the internet. So we're hoping that we can work on that once we get back. I don't, what else? Was there anything else you'd like to know?
Is there anyone have a question? Mayor Cantor.
Thank you, Councilor Sweeney. Hi, Gina. Thank you so much. I know you've been in touch with so many people. I've heard about it firsthand from my mom. And it makes such a difference. Couple of thoughts. You mentioned that a lot of seniors don't have internet. Is that because they, either can't afford it, they're not in an area that has it, or they just feel uncomfortable using it. Do we know why because that actually keeps them extremely isolated, right? So just wondering, that's my first question. You're on mute, Tina. You have to repeat it.
Okay. I think it's a combination of all of those things. A lot of the older people were not interested in technology. Our computer programs died out because people were not interested in learning about them. We were, as the Connecticut Association of Senior Center Personnel, are looking to hopefully work out some kind of program where we can get laptops donated and maybe some internet access donated. And then we need to worry about the training. I have had a conversation with Martha about potentially doing something with the library in the near future, but it's a big project.
So this is one of the thoughts that part of that community collaboration that we've been thinking about. There are so many college students and high school students. High school students are still in school. College students have been graduating last weekend, this weekend, that are available and could be technology resources for seniors. And a few people that I reached out to, and actually even on Capital Workforce Partners discussion, there was talk about supporting seniors in technology, like being their technology counselor, supporter, whatever that is. So I think there's some possible opportunity there to support that transition. Again, this isn't going to be short term for, especially for seniors. It might be, they will be, more resistant and should be they are more at risk and should be more resistant to going out and participating in activities. So I think this is an opportunity. We had talked about the Hartford Foundation, some grant opportunities. This, I think, is especially for seniors that can't afford. This is at least an identified need that we now can potentially try to problem solve, right? And maybe we as a town can't do it, but we can have partners that will help us to do that. So, okay. The other question that I had was, I don't know, I think that's good enough. Thank you.
Ari, do you have your hand up?
Thank you. Am I still muted?
In and out.
I just wanted to, okay, I'm trying. I just wanted to, maybe if there's a way to connect with Gina, only because in my program, we actually, I submitted a grant for Hartford Foundation for Public Giving for telehealth specific to COVID. There's an emergency COVID response grant. And there's a lot of resources available for free internet. So if you wanted to connect, I could, because a lot of our kids don't have the resources.
That's great. Well, why don't we we'll connect you offline. Gina, thank you so much for all that you're doing. Really, really appreciate it. We know that to the point that Helen was making about the kids. I mean, there's really no there's no room for any mishaps with what you guys are doing because of the because of the population that you're dealing with, and we really just appreciate everything you're doing right now. And understand that it's very touch and go. So thank you. And then Helen, we have one more subject, then you're off the hook.
Thank you. Off the hook for half of my job. So the last part in the leisure services side is on the facilities that could potentially be reopening. And as you know, parks were never closed. We have park supervisors covering our parks. Some are doing individual parks and some are covering multiple parks. And that's really to help enforce and social distancing, and also to help educate the community about why the playgrounds are closed, for example, or why they shouldn't be playing ultimate frisbee, but maybe should be doing something else instead. The state has been sending out some executive orders about how to reopen certain outdoor recreation activities. Their executive order PP identified a number of activities that were allowed. West Hartford had 3 in that category: golf, driving ranges, and tennis. And as you know, golf and driving ranges we opened on May 10th with a lot of safety protocols in place. That has gone very, very well. And we also have developed, Mark Blanchard is on the phone, and he will explain the proposal that you have to make a decision, hopefully this evening, on tennis and pickleball. So these, again, are what we consider to be fairly low risk sports that are deemed permissible by the state, but we would like your permission and your input onto whether that should happen in West Hartford. So I know we have Mark Blanchard, who's the manager of Leisure Services, on the line. Yep.
Mark, you're muted right now. Helen, do you want to just?
Now, can you hear?
Oh, there we go. Go ahead, Mark. Fire away.
Okay. Thank you, Councilor Sweeney, Mayor, and council members. I appreciate the opportunity to be serving on this board. If you had a chance to look at the file attachments, I worked with Alicia Michaud and Bob Palmer to come up with a plan to allow for tennis and pickleball. We included pickleball in this partial reopening. It kind of is a stepbrother to tennis. The courts are similar. It's a paddle sport, so we included the pickleball as into this proposal. The Municipal Operations Recovery Section did forward this memo to the Executive Policy Group on May 15th with our kind of idea on how we could safely reopen the tennis courts and pickleball courts in town. We use the USTA guidelines kind of as our guiding light. They put out a lot of information right at the beginning of the pandemic that was very good and kind of a good tool for us to use for the guidelines that you see in the attachment that basically kind of state the rules and give a good baseline for what we exactly want people to do when they're playing tennis or using the courts. So that is one of the attachments that you see. Our recommendation is that we would open up 50% of the tennis courts. So we would put nets up on half of the tennis courts in town. The reason we kind of landed on that was we felt as though that makes things a lot safer, but it also totally promotes social distancing. And we also felt that it's easier to add courts than to have to decide that we're going to have to take some down if people aren't following the rules. So we felt as though a slow rollout would be better for everybody. And this also would accommodate and allow people to play safely and spread out. One of the other proposals was that we would have all of the gates, when possible, be locked open. So that would eliminate an extra touch point as people enter the courts. They wouldn't have to touch the latch or touch the gate. So they just are able to enter the court without having to touch anything. The one sidebar on this is the Whiting Lane tennis courts are currently scheduled for some renovations and rehab. So those are currently out of play right now. And the Fern Hartruth play courts are also not set up. Those are set up by a contractor. And due to the COVID pandemic, the contractor is been delayed in his whole schedule, basically got pushed back and delayed. So we're still waiting to find out where West Hartford sits on the queue to have those set up. So if we were to release tennis courts in the near future, those courts would be on hold until we can get those set up by the contractor. I'd be happy to take any questions on this proposal.
Thanks, Mark. Does anyone have any questions? I know that we had some questions online about the opening of playgrounds. Helen, can you just touch on that? I know that that's obviously touches on a lot of things that we've already been talking about, multiple touch points, things of that nature.
Sure. Helen Rubino Turco, Director of Leisure Services and Social Services. So the list of outdoor recreation activities that were cleared did not include outdoor tracks, basketball hoops, playgrounds, athletic fields, or pools and splash pads. So those all remain closed at least until June 20th. I anticipate that sometime during the week leading up to Saturday, June 20th, that those discussions would be had at the state level as well as within our own district, health district level. But, you know, the outdoor tracks are not necessarily the problem. It's the athletic fields that are inside those outdoor tracks where large games could be held. The basketball hoops, again, were taken down because of the physical game and the, you know, sharing a ball. So we did have some obvious health considerations about that type of activity with the playgrounds. You know, we're in a wait and see holding pattern. We have had some people try and unhook the swings from the swing sets, and you know, we're doing our best to educate our community about the dangers, but that's why we also continue to have park supervisors in our parks right now, all day and on the weekends, just to try and, you know, stay ahead of that activity. So there is no, those activities, as I said, outdoor tracks, pools, splash pads, basketball hoops, playgrounds, and athletic fields are not on the list for approved activity through from the state.
Thank you, Helen. That's very helpful. Any other questions? So with that,
I'm sorry, I was trying to text you. That's why I had my phone. This is Councilwoman Mary Fay. Clearly, a constituent had approached me earlier before the meeting. Actually, Lim, you as well. Clearly, we're not going to be able to bring the other sports in, like baseball or softball or anything else that occurs over the summer due to the constraints that we need to implement on the fields. Correct? Is that right?
Yeah, this is Helen Rubino Turco to answer that question. That's correct. Right now, all of those activities are not permitted by state decree. Yes. I did want to say we also have some facilities that remain closed. Mark Blanchard has been serving with Bob Palmer and Lisa Michaud on a committee to look at all, and Martha Church, to look at all of our facilities and to try and figure out how and when they could reopen and reopen safely. Certainly our two senior centers and are sort of in the same category as the libraries, as Martha would tell you. This is a high-risk population. We anticipate that they would be at the very end of any reopening phase that we might come to. So I would hazard a guess that we would probably be having a conversation about senior centers at the end of the summer to see whether they could safely reopen in the fall. But the community center, Elmwood Community Center this summer would be open for camp only. And Jamie Krajewski has made it very clear that she needs to have control of that building and control who comes in and how the cleanliness of the building and the safety of the people that are operating in the building. So that facility would be closed to the public during the summer. It would only be open for the purposes of camp, and that's to protect, obviously, those programs. We also have an indoor skating rink. And why aren't we having a camp there, you wonder? Well, a skating rink is one big, large gymnasium, if you will. And our interpretation of that is that it's sort of like, well, if a gym is open, then maybe the rink could be open, but with smaller numbers of people. Well, gyms aren't on the list of things that can reopen, so it remains closed. Could we possibly have a camp there? Well, we might be able to have, there are 2 rooms and a sheet of ice. So we could have a group of students in one room and then using the ice that day, and the other in another room using the outside, using the fields next door, doing other activities. And then the next day they would switch responsibilities or areas of, and the other kids could go on the ice. So we could figure that out. We're holding that in our back pocket for the moment because we're also trying to find a suitable location to offer camp for the Hillcrest area neighborhood. This is a camp that usually goes to Kennedy Park, but with no splash pad and pool, that camp doesn't look very, very good. And we can't have it without an emergency shelter, which is Elmwood Community Center. So Elmwood is already full up with its camp. So we would, we're sort of thinking creatively about where we might be able to have another camp. But more details on that, as I said, this is, we're only in the discussion phase at this point because we don't know when we could reopen the rink. The third facility that I wanted to mention is Cornerstone Aquatic Center. That right now is closed until at least June 20th. And we would like to have reserve some time with you at a future meeting to discuss the Cornerstone Aquatic Center and some improvements that we would like to do there before it reopens. So that's pretty much, I think we've covered the gamut of our parks and our recreation facilities. I'd be happy to answer any questions on the park side and the rec side.
I would like to just, if there are questions, we'll hold them to the end. I want to move on to be respectful. Martha Church's time. We are now in the second hour of this conversation. So thank you, Helen. Thank you so much for your efforts. I know that we'll probably be hearing from you in a little bit, but I just wanted to first say that, it's clear a lot of thought has been gone into this, and we really do appreciate the work that you've done. So Martha, the floor is yours.
Thank you, Councilor Sweeney. This is Martha Church, Director of Library Services for the town of West Hartford. So I want to first sort of bring you all up to where I am in terms of library service and where we have been over the last 8 weeks since we closed on March 15th. We closed our buildings. Obviously, library services did not close at that point in time because we are in the fortunate position of being able in this day and age to offer online services, which we do as a matter of course. So we simply sort of pivoted and switched to a real push to promote those online services and at the same time continue some of the things that are actually standard library operation, and just expanded them as part of our services to the residents of West Hartford. And one of those was to have our professional library staff, who, as a matter of course, during library hours are answering phone calls and questions from residents all the time. We took over answering some of the town phone. I don't know how that happened. Has everybody heard me to this point? Yes. So the library staff have been working remotely, so buildings closed, but working remotely to answer phone calls from residents. And to date, we've done over 1,700 questions and inquiries from residents on all kinds of subjects. The stuff that we get as garden variety library questions, and then the stuff that is actually specific to this situation in this point in time and has more to do with various different town departments. And so those are things that we've been doing as a matter of course. We are also, as the town manager mentioned earlier, we are supporting the public information officer for the town with some support in terms of communication, social media posting, the graphics that go along with all of that. We meet on a 3-time-a-week basis with Renee McHugh, who is the town public information officer, to talk about what the messaging needs to be for the week and how we can assist with that. The benefit that kind of goes along with that is that then we are very much attuned to any messaging that is going out from the town. And in fact, those folks who are answering the telephones are then able to have that information more readily available and be able to put that out to the public. And so we're maintaining our own web pages with public information related to the COVID emergency, related to activities people might be engaged in, related to things like food resources in town. All of that is stuff that library staff is working on an ongoing basis to make sure the information is current and accurate and up to date and easily accessible. And then if you call us on the phone, we can direct you there, or if you find us on the webpage, you can find it on your own. So that's sort of just an expansion of what libraries do during their regular course of events. And I know that you're more interested in what are we going to do coming up next. So I can stop there, and you can, if anybody has questions about what I've said so far, I can take those.
Why don't you just keep going, Margaret?
Okay. So in terms of what comes next is we're going to keep all of those things going, and we will be looking to very soon start to add some access back to our physical collections. And that will be in the form of a curbside service, which many of you may have heard. There's been a lot of discussion about that. There are communities nearby who have been offering that through the crisis situation. We explored that at the very beginning and were advised to wait on it. That turned out to be, we think, a pretty good decision, as it became a very controversial service in libraries around the country, while folks still didn't have a good solid handle on how this virus is transmitted and what kinds of ways that service can be provided in a safe way. Because unlike picking up your groceries or your takeout dinner, library materials come back. And so if they come back contaminated, there has to be a protocol in place for handling them. So we are now working at bringing some limited numbers of staff back into the building so that we can open up our book drops and start to receive materials back into the buildings, get them, make sure they're decontaminated, they've had a period of quarantine, and then start to fill the requests for library materials from the public. And we hope to be rolling that out in early June. I don't have a specific date yet because with all of these things, there are dependencies. We are reliant, as you know, I think, on the town facility services for the maintenance of our buildings, and just to have staff in the building, we need that regular building maintenance, which we have not had because they've been focusing their energies on the crucial first responders during this period of time. So that's the first thing that we anticipate coming back in early June. Beyond that, and again, I don't have dates, but we would be looking at sort of midsummer, I hope. to start to think about doing one-on-one computer appointments for folks to come into the libraries and use our public computers. This is another area where we need some support from facilities. We need to spread our computer resources throughout our buildings to separate people and make sure they're appropriately socially distanced from each other. And we need to make sure that our building occupancy levels are consistent with what the safety guidelines are from the CDC for buildings, for office buildings, because that's sort of what we are. Helen referenced the fact that, you know, the senior centers are sort of an akin population to those we serve. Well, we serve everybody from the very youngest to the very oldest. And so we are not sure what phase we are in the recovery plans for the state. I've heard that we're lumped with the schools. That Lieutenant Governor was asked that question a week ago at a press conference, and she sort of lumped libraries in with the schools, but I've not seen that in writing anywhere. So we really don't know where we're going to fall. So that's kind of where we're going. We're proceeding with caution, but obviously our goal is to continue to serve the public as a source of information to all residents. And I do have Carol Waxman here with me tonight, and if you have time, she can talk a little bit more specifically about summer virtual programming for youth and children. Shall I have her go ahead with that? Carol?
Good evening, everybody. I'm Carol Waxman, Children's Services for the West Hartford Libraries. So we have been filming programs since mid-March. Most of the children's librarians are filming the programs in their homes. Preschool story times, music and movement, book talks, cooking programs, craft programs, whatever we think the family will be engaged in. We've had many comments and compliments and many views on Facebook. We're thrilled about that. But usually the day after school ends, we have hundreds of children coming through our doors the entire summer. How do we reach them? What do we do? Well, with an incredibly talented team of children's librarians and a teen librarian, we have a full summer planned. Yes, will they be in front of a screen? Yes, but we have many times that the family will be engaged together. We'll be offering book talks. There will be a game board sent to every child from their school packet that offers challenges for them to do through the summer. There'll be a book club for tweens. We're offering a talent showcase for children, teens, and families. They can film an act that they want to do, and we'll string them together and show them. So what about the teens? What do the teens do? Jobs? Who knows about that? We have to engage them in many ways. And one way that we are going to engage them is to become a book buddy. For teens in grades 9 through 12, they will be paired with children in grades K through 3 through Zoom. They will meet in rooms and the teens and children will read books together. They'll sing together, they'll play guessing games and just meet each other and have a great time. We'll try to accommodate as many teens as want to come and as many children as want to come. There'll be Tech Tuesdays for teens that a 9th grader at Conard will teach in the form of coding. There'll be virtual Harry Potter week. Yes, Harry Potter is still huge. There'll be Minecraft meetups. There'll be Zoom gaming where they can play trivia and Pictionary and all the games that they like. There'll be a book ranting club, which is an unstructured book club. And we'll do anything else that parents suggest and the kids want. We want them to engage with us as much as possible. Thank you.
Carol, that's really fantastic stuff. We've heard a lot of doom and gloom, and I just love that you are making lemonade here. And I think we all appreciate that. I don't know if anyone has any questions, but I just want to commend you on that, and also see, we love the again, I think this is another place that we need to come back and have more conversations about, taking some of the creativity that clearly that you guys are working with and try to bring it to some other sectors. But that's fantastic.
Thank you.
Mayor Cantor, did you want to speak?
No, Carol, the programming is incredible, and we want to make sure that we're getting the word out about all that you're doing, because I think there probably are a lot of students that normally might not be in your, coming in, but might find that they have a lot more time on their hands and might be very interested. So that's one of the things I think we really need to make sure that we push and we get out to parents and students. Martha, we get a lot of questions about what's happening, especially Bloomfield Library for some reason. Could you just talk about what our library is doing as opposed to Bloomfield and other libraries in the region?
You're referring to, oops.
I think I'm talking about the books and also some talks and potential any kind of what are other libraries doing? Any plans to do anything more? I don't think with the governor's order you will have the ability to open. Is that correct?
As far as we know, we don't have the ability to open, nor do we think it's advisable at this point, because when you open a library, public libraries by sort of definition are free and open to all, so that stopping people at the door and then limiting their behavior when they're with you in such a way to make sure that folks are socially distanced, if we have to take temperatures at the door, all of that, Mayor Cantor, makes it difficult for us to manage that inflow of people. So, but we have been, you've heard a lot from Bloomfield residents about what Bloomfield is doing. Our library newsletter, which goes out once a week on Wednesday evenings, has been opened on average since we closed by over 5,000 people each week. And the library newsletter has been full pretty much from the beginning with a lot of the activities that we are doing. And we have a full complement of virtual programs ourselves. So I'm sorry that the people that have been holding Bloomfield up to you as a as a wonderful thing, they are doing some very good work, but so are we. And I would hope that those people would sign up for our newsletter and take a look at what we have on offer. Most of our regular discussion groups have been meeting regularly. Our New Yorker group, which has over 30 regular participants every week, there are probably more than 100 people who come and go at various points in time to that group. They've been meeting on Zoom pretty much from the beginning. Our regular book discussion groups are meeting. Our writing groups are meeting on Zoom. Our cookbook club has been meeting. They've had 2 meetings on Zoom so far. So we're bringing back outside speakers and authors that were lined up, sort of, we backed them off for a little while because we had to get their buy-in to doing these programs in a virtual environment. But that is starting to happen, and we foresee a lot more of that coming down the road. The other major difference between Bloomfield is one that started curbside service early and has continued it right on through. And as I said, we looked at that in the beginning and were advised by some of the members of the emergency operations team to hold off on that for safety reasons until we better understood how the virus was behaving and what protocols we would need. And so as we begin to roll that curbside service out, we have a work group meeting, again virtually, to determine all the things we need to put in place inside the building and then in our interactions with the public. So, basically at each of the 3 libraries, there'll be a period of time each day when you will have an appointment and you'll say, you know, I'm Sherry Cantor and I want that great new book. And we'll say, it's ready for you, Mayor Cantor. Would you, you know, please come at 11 o'clock, and you'll come to the front of the building, park in parking space A, and tell us you're there, and we'll come out with the book and dump it in the trunk of your car. And you'll never even have to talk to us. We will be masked and gloved. And so we, you know, hope in this way to be able to keep the staff safe and our patrons safe, and still supply them with the materials they want.
I think that's probably the part of the angst is there. People are anxious to engage with the library in a more physical way. That's probably it. But and so much of what you do, just, you know, if people aren't reading the letter, they don't know. So and the time frame of your opening, do you have that?
So the curbside service, I'm hoping for early June. We're looking today at June 8th as the first sort of official curbside. We of course have books sitting on our shelves that we've been holding for specific individuals since the middle of March. That group of materials will go out first. Those people will kind of have first dibs on all of this, and then we'll start to encourage people to go ahead and place their holds on our materials as they normally do, by either using the library website online or by giving us a phone call. And then we will be able to provide services to everybody that way.
Thank you, Martha. That is fantastic. Love to hear what you guys are doing. And I think we'll definitely need to talk more about how we can continue to use all the resources that you guys have at your disposal to help others in town get connected to some of the great stuff that you guys have there. So again, I want to be respectful of people's time. We are now approaching our second hour. And I want to move over. Helen, do you mind move on to Astra?
Sure. Helen Rubino Turco, Director of Social Services and Leisure Services. Quickly, I want to introduce two of my colleagues. Astrid Calderon is the Manager of Social Services, and after her is Suzanne Oslander, who is the Manager of Community Partnerships. And in social services, you've heard about the CLASP program, the phone calls that we've been making. We have 3 groups of people making phone calls to vulnerable people in our community. And that's going very well. It's evolved over time from kind of, the immediate needs at the beginning to some people are weaning off and some people need, it causes an action. So they need medication or they need food delivered. And Astrid can talk a little bit about that, but she'll also talk about a mask distribution or cloth mask distribution to our high-risk population, the rent rebate program, which has evolved from an in-person activity to a mail activity, and that is something that Astrid set up. Also, she spent a lot of time working through a donation from the United Way to support Alice families, and she'll talk a little bit about that. So on top of that, they've got their regular clients that they're used to seeing face-to-face, which is now all on the phone, which is really time-consuming. And they're maxed out, but we're delighted to have Astrid Calderon here, and she'll just touch base on a couple of these programs. Astrid.
Good night. This is Astrid Calderon, Manager of Social Services. Thank you for having me in this committee. It's my pleasure to serve the town of West Hartford as the Social Services Manager. We have 4 full-time social workers and 1 part-time social worker. Our mission is to make sure that we can serve as social workers in the community to all populations. One of the things that we have been trying to do is to stay together, be inclusive, work with other departments. This is how we started it during this pandemic. One of the first initiatives was to start collecting information, keep the population informed. We started sending to the libraries and other entities updated update information about what to do when you need food, the food stamp situation, Medicare, all the government, federal government, and local entities about what to do. So we have been able to provide that information to the libraries. We continue to work with them. Within this collaboration, we started another project, the Community Life Safety and Support Program, that is CLASP. We got together with the fire department who run a registry and have approximately 300 people in the registry that they voluntarily enter into this registry to make sure that they are informed when difficult situations happen in town. Therefore, we analyzed this list of residents. Most of them are homebound, but some of them are very, very compromised residents. So we decided to split the list of our residents in 3 categories: red, orange, and blue. The red means the red group, it's being called by the fire department. This is high-risk people that might be in need of oxygen, or they are double amputees, or they are very medically compromised. Moderate risk people, the orange list, it's being given by the social workers to continue to do some action, support mental health, and multiple services that they might need. And then the blue people, started with wellness calls, making sure that they are handling the situation. After all these weeks of call, we're still calling them every week. There are people that feel more secure in town. They have decided to receive less calls from us. In this process, we have been able to serve them with multiple things, between basic needs like food, Meals on Wheels, delivery of food, internet connection, unemployment, et cetera, et cetera. We have been able to work with them intensively one-to-one. This was the CLASP program that we started planning on March 17, basically. The second program that we started was unexpectedly and very happily, we received funds from the United Way. We received $6,000 to distribute to 30 families in town. And the task was to determine which families we were going to give this money, all electronically, all by using the telephones, etc. So we put together, we worked together with the West Hartford Board of Education. We got families from all the schools in town, making sure that we cover all the areas and everybody's included. We were able to screen people who is affected by the COVID, who lost childcare, who got sick, and who lost wages because of the pandemic. So, and who will not be receiving any federal assistance. We were able to distribute, every family already received that already, and United Way have been collecting more funds. So they will receive, they receive an initial amount of $200, and now they're coming with the second wave of money. And that it's deposited in the wallet, in the telephones. So it was a little bit of technical piece of education that we were able to provide to the community too, to teach them how to use their telephone for this type of activities. When this pandemic started, we were monitoring the programs from the state of Connecticut. The renter's rebate, it's a program from the Office of Policy and Management. In our town, I manage the program. This is for elderly and disabled to receive a rebate if they rent in town. Therefore, in October, they will receive about, if they're eligible, up to $700. This program was not canceled. It's done in person. So we decided to make it remotely. So we were able to send applications. We sent 700 applications for all elderly and disabled seniors that rent in town. Right now we are processing the applications, collecting in the portal of the state so they can receive the rebate. This is something new, but it's working very well. Maybe in the future we will continue to make programs differently. I wanted to say that right now we started receiving requests from the community to be active. The community wanted to give back. So there's a lot of very generous people making cloth masks. Not only individuals, but also group of people that gathered together. One on April 20, the governor, stated that we have to use masks publicly. So masks have been received in different departments, but we decided that we need to put something together to give it to people. And we narrow this high-risk people, giving the masks to them first. So therefore, we started working with West Hartford Authority for the places that we know there are seniors, obviously, and disabled people. Alfred E. Plant, M. Grove, other congregated buildings like 616 Newport Avenue, a Fellowship, Federation. We have been able to distribute to them. In the process of reaching to the community, we found out that the West Hartford Housing Authority also have been giving masks to people. So that was a very good news. We have people that cannot get masks, so we have been delivering to the houses, as well as food and enrolling people in the Meals on Wheels program. We have a great food pantry, and Suzanne will talk about that, but there are people that cannot cook. So we have been using other resources. I have to mention that we also manage the Dial-A-Ride program, which is working right now. We have to limit the program for riders. We kept all of the riders that we have, which all of them were seniors. We limit all of the trips to medical visits and grocery shopping, and also a trip to the Elmwood Community Center in order for them to get food from the program that it's run there by CRT. We finished during this pandemic all the energy assistance program, and everybody was able to do it remotely, which is great. So people were able to, get the money that they have for energy. At this point, I have to mention that the social workers in town, which are, again, I said 4 and 1 part-time, including myself, continue to do the same things that we do all the time. Right now we're dealing with receiving people that are dying and grieving. So we have staff trying to help people with funeral arrangements on people that need it. We started seeing more domestic violence, child abuse, exploitation, sexual assault. So we have been trying to mentor, doing advocacy, all the case management piece with basic needs regarding not only food, which is a big topic, but also help with utilities, rent, how to negotiate with landlords that are not getting paid, and let them know what the law is saying, what are the protections, etc. We wanted to be positive, and we wanted to take care of ourselves. So we started contemplating what is that we're doing for ourselves, how we are taking care of each other and taking care of ourselves during this time. So we started talking with our own HR department about what are our own strengths, how can we promote resilience in the community, how can we promote self-care, and what are the things that the social workers are practicing and preaching to others in order for the people to join us in this journey. I wanted to say that we are receiving all the help, all the feedback, all the input that that we need, and we will receive it all the time. We're very, we're very lucky to have the ability to work with multiple departments and have very good, solid relationships, so we can continue with the support with the fire department and police as first responders. Right now, we're dealing with a relocation issue. We have 6 families that are homeless in a hotel that we're helping because of a collapsed wall. And this is the type of situation that the pandemic have made it quite difficult with the distancing. So we are going to continue to be open-minded and receive any assistance and feedback, positive, negative, from any of you. If you have any questions, I'm available now.
Astrid, thank you so much for that very comprehensive overview. I do have one question, and I'll kick it out to I think I see Councilor Blanks with their hand up. We had a report recently at our council meeting that that the town had not seen a bump in domestic violence from the police side of things. Obviously, we know that that's not necessarily, not all these incidences are called into the police. However, the national numbers are showing a completely different show. And so if you could just kind of, obviously a lot of that's confidential, but just big picture numbers, would like to kind of hear what you guys are, what you're seeing and hearing.
I believe that this pandemic have exacerbated multiple behaviors, issues. Certainly poverty is the main thing, and the stress that having, trying to juggle with multiple roles. Domestic violence, as you guys know, you will get the reports, the public reports, but there are other instances that this is a private issue, so you will not know that this is happening. So we see it, we support the people that, in the past come through the door, now they can call us. We will try to put together the connections with all the domestic violence programs. All the social workers are trained to do that, make sure that there's a safe plan, and that we're listening to that person that is abused. In certain cases, there are children involved, so we have to involve other state agencies. So we're following the same protocols. Again, there's more to come. I cannot tell you how many numbers I have right now. But again, this is part of the regular social programs that we deal with.
Councilor Blanks, and then Councilor Fay.
Thank you, Councilor Sweeney. Through you, Councilor Carol Blanks. Question, first of all, Astrid, I just want to applaud you and your staff. You're doing awesome work, and it's clear that you are working hard, probably overtime and over the overtime, but really kudos to you all, because you're doing great work, and this is really the time that so many of our residents are in need of your services as well as your support. A question that I may already know the answer to, but I'm going to ask you the question, especially for those who may be listening. With your staff, how many of your staff, or maybe perhaps all of your staff, are able to provide services to families whose English is their not their first language? That's my first question.
So we are very fortunate to have social workers that are bilingual and bicultural in a few languages. Our town is very rich in languages. Therefore, we will never be able to provide for all, but we find a way. We have connections to make sure that we communicate. Our staff directly, there's three staff that speak Spanish. I speak also Portuguese, and everybody have been able to use other resources in the community. We are connected with the Russian community. We are connected with a very special person in the library, Pramod, that have the ability to speak more than 5 languages. So we have been able to reach to the people when we are in need. We also use technology because of privacy to make sure that we're using whatever it's available for the children. We have staff in the West Hartford Board of Ed that also collaborate with us when we need to take care of children. We do receive a lot of referrals from them too. So we think about that, and languages is one of the things. We translate our documents. Mostly recently, we did translate the renter's rebate form that they didn't have, and they appreciate, and it was us, and give it back to the state. So for a review, so they can have it. So this is something that we have to pay attention because of the large diversity in our town.
Thank you. I appreciate your response. And I have a follow-up question through you, Councilor Sweeney. You mentioned that the Dial-A-Ride services has been decreased, if you will. And I'm wondering, especially for our senior residents who may have used Dial-A-Ride, and correct me if I'm wrong, and I'm thinking about medication. How are those residents being assisted, especially during this time with social distancing and physical distancing, but still need their medications on a regular basis? I'm wondering if your staff and you support them in that area.
Dial-A-Ride, it's have about 200, almost 300 riders on regular times. So when this pandemic started, everything got a little bit confusing. We asked our contractor to make sure that there was a standard practice in terms of cleaning and disinfecting the vehicles. Other Dial-A-Ride programs were shut down in other municipalities or reduced. We didn't want it to do that. So that's why we continue to provide the medical and the grocery shopping. With the medical, this is regular appointments, but also we have a more intense medical program, which is for people that need more than just a regular visit, like, let's say, dialysis 3 times a week, or a cancer treatment, radiation, stuff like that, that is intense. So we kept that because other, they will not have any other resources. Now, we always work with Plan B. We work with the Great Hartford Transit District because they provide transportation for temporary disabled people, and that transportation never stopped. With that, we have a taxi voucher opportunity that we can make the rides cheaper. ITN was canceled because of the pandemic, and we're looking forward for them to reinstate. We also were working with volunteers that were doing grocery shopping that we have to reduce. So it have been a one-by-one case, moving pieces situation. We just find that out that our contractor is by the state of Connecticut. They are allowing to bring people to go to the line if they need to be tested for COVID. So it's not a drop-off situation, but they can go with them. So it's not a perfect, it never have been. It have been very challenging. And we will continue to review all of the this next year for the Dial-A-Ride program to make sure that we're improving, everything that we have done. We did recently review the program and added a lot of other locations just to make sure that you guys know the riders can go to multiple supermarkets in town. They used to go to the mall, Stop and Shop, several Stop and Shop. So they cover the whole map of the town. And it's been reduced. We have substituted that with the people that are remotely giving food, etc.
Thank you for your response, Astrid.
Councillor Fay?
Thank you, Mr. Sweeney. It's Mary Fay, Town Councilor Mary Fay, and Astrid, again, not to be redundant here, but thank you for everything that you do for our community, you and your team, and Helen, you as well. And Martha, of course. So they're all great social services that we have in West Hartford. Quick question was, and you may not have the answer, so that's fine, but as I think about this, our town has some basic needs with 30% of the kids on reduced or subsidized lunch. Obviously, the need is up with the COVID virus and people out of work, et cetera. Do you have the resources to meet the needs of these folks? And do you know, or can you anticipate the variance you might have with budgets for some of these items? And maybe Helen, you can weigh in on that. I know this isn't a financial meeting per se, but just so we can kind of get a feel for what we may need to provide in terms of funding for all the needs that are resulting from the virus. Thank you.
Helen Rubino Turco, Director of Leisure Services and Social Services. I know for COVID specific requests or funding, we can track our expenditures and we report them through our incident command system for tracking and then potential reimbursement from FEMA. We also have funding from CDBG. We are an entitlement community, so we receive community development block grant funds. And there's a specific additional set of funding for COVID-related expenditures. So we should be able to tap into that for programs that meet the requirements of CDBG. In addition, and particularly at the mayor's urging, we continue to search out additional grant opportunities. And so we are looking at, making some additional grant applications, but things like the ALICE program from the United Way, sort of they approached us and said, we have money, we want to give it to you. And I laughed when Astrid told me this because I said, there's no such thing as a free lunch. And the work that Astrid and her team put in to making that money available and into the hands of people quickly was astonishing. And that is because of Astrid's leadership. She said, 30 families, 15 of the, we've got 16 schools. So immediately there's one per school, so that every school was touched. She worked with Board of Ed. These are and then still had money in her back pocket to pick another family from that school so that people felt, and these were really impacted individuals. So I think in terms of, do we have funding going forward? I think we have funding. I would be remiss if I didn't say we could really use another social worker. But I do understand how pressed we are for, for staff. But we do, this is a team, and Leisure Services and Social Services and Suzanne, we all think on our feet. We are all incredibly nimble when it comes to finding solutions. And that is what Astrid has been, trying to describe to you. So some of our class callers, for example, are from the library. Some of them are our two senior center directors. You have Gina on the on this call, who is one of our class callers. But these are people who, they find ways. Martha and her team at the library receive all of these questions, like, what time is it in China to, where can who can deliver food to my house? And the communication between our needs and the information that is disseminated through the library is critical. And that has been a wonderful blossoming relationship outcome from this pandemic. So funding, I think we're, we are searching for our resources all the time. But as I said, if you can find another full-time person, we'd be really grateful.
Thank you for that answer. While we're on this in this arena right now, I also wanted to allow for Chris Dutton and Jonathan Merritt to chime in a little bit on what they're seeing as well, because I feel like we're kind of in the same arena here. So Chris and Jonathan, you guys want to just kind of touch upon what you guys are seeing as well? Before we transition, I just wanted to say, Astrid, like this is amazing stuff, and I just am very I'm inspired by the work that you're doing. Ellen, thank you for that background that you provided to us that we don't see on a day-to-day basis. I know you're working with a lot of people that are invisible to a lot of people, and I love that you're making them visible here, and we really, really do appreciate all the work that you're doing. So with that, I'm going to go hand it over to Chris and Jonathan.
Thank you so much. Before I speak, it looked like Helen had her hand up. I don't know if she had something to add.
Go ahead, Ellen.
Thank you. I just wanted to mention Suzanne Oslander is also on the call as our last, I know she's been waiting a long time too, our last employee to report on the food pantry and the Town That Cares. You know, she's been working really hard with
my apologies
with the Board of Ed on the lunch grab and goes. And so Suzanne, did you?
Sorry about this, Suzanne. Go right.
Thank you.
I apologize.
Suzanne.
Hey. You're unmuted. Go ahead now.
You can hear me?
Yeah. Get close to your computer.
Okay, I'll get a little closer. Sorry about that. Thank you, Councilor Sweeney. This is Suzanne Oslander, Community Partnerships Manager in Social Services. I wanted to start off. Can you hear
Suzanne,
me?
a little bit. We got a little bit louder.
Oh my goodness.
A little bit
Okay.
closer.
Let me get closer. Sorry about this. So I wanted to start off by really expressing my heartfelt thanks and appreciation to the community for their tremendous support. We have received so many donations of food, financial contributions, as well as offers to assist us in many different efforts. So, you know, we really are the town that cares, and it makes a tremendous difference in our ability to serve the community. I just want to make sure, can you hear me? Yes? Okay, thank you. All right. We are doing things a lot differently now in the food pantry. Obviously, we're having to distribute food outside. So let me just tell you a little bit about what we're doing. We're collecting and distributing food outside of the town hall lobby entrance. And we're doing that on Tuesdays from 3:30 to 5:30, Wednesday 9 to 11, and Friday 10 to noon. And what we're seeing is more and more residents who are definitely in need of assistance. So, you know, we're looking at, especially over the last 4 weeks, we are probably giving out about, on average, 220 bags of food a week, which is more than 160% of an increase over the last time period for last year, if you compare it to last year's numbers. So we're definitely serving more residents. Of that, I would say we're having about, 450 households that we've served since mid-March, and a third of those are new households. So these are residents that have not come to the food pantry before. When they come, we are sharing information from our other food pantry, our food program assistance partners, Fern Street Ministry, St. Thomas the Apostle Church, as well as Food Share. There are other food programs in town. There are 3 mobile food shares that exist in town, and we're sure to give them that information because the town of West Hartford's pantry is a non-perishable food pantry. And so through food chairs, mobile sites, we're able to make sure that our residents in need do get perishable food options. We've had to change how we are actually doing all of our food pantry operations inside and out. Many of our volunteers that we have had in the past who have assisted us with food pantry programs have not been able to assist us, so we've had to recruit additional volunteers. We have about 25 volunteers currently that help us with all aspects of the food pantry. That includes picking up food at grocery stores, delivering, packaging things for our residents who are in need. So we are extremely grateful to the many volunteers who are spending their time at the pantry getting us ready to assist our residents. We have also been delivering more food to residents who are in need. Many people lack transportation or are just not comfortable going out to the town hall to get food. In addition to that, we are providing food assistance at Hannock, and we do that during the grab and go distributions that the Board of Ed provides. So on Mondays and Fridays, we are providing food bags at that site as well. During that time, we have our food pantry program available, but we also have Vanika Blythe, who is our program coordinator over at Hannock. She is connecting with many of the residents in that neighborhood. So if they are in need of food, she is available, but she is also available to assist them with other resources that they may need. Oftentimes we are connecting them with Astrid because there may be a social services need that they can assist with. But that is one of the things that we are doing. The Board of Education's grab and go meals have been tremendously successful. I believe they have 6 sites in town, 5 schools, and then also at Hannock. And they have given out thousands of meals since doing this, I think in mid-March. We have been talking about whether they will be doing it in the summer, and they are still working on the details. They recently got a waiver from the USDA to continue to provide meals off-site of a school, as well as to give children the opportunity to take the meals home with them. In the past, it's always been something where you have to have the meals on site. So they got permission to do that during the school year, and they recently got that permission to be able to do that, I believe, through August 31st. And we are hoping that we will be able to offer these grab and go meals at sites throughout West Hartford during the summer. But again, those details are still being worked out. In the past, we have had an open summer meals program site at Faxton Library, and we've had a closed site at Hannock during the morning academic program that the Board of Ed puts on. But for obvious reasons, these are programs that may not take place. So we are really hoping that the grab and go meals will offer a really substantial nutritional program for families in need during the summer. In particular, obviously food is needed all year round. Sometimes people don't think about what times of the year you need food the most. A lot of times people donate during November and December, and they think that's the time of the year to donate. And we are so grateful to receive those donations during the holiday times. But what I can tell you is the times that food is needed the most is actually anytime a child is home. Summer vacations, school vacations, and of course now children are at home 24/7. So this is making it even harder for families who are strapped. People who have been struggling to provide those nutritional meals for their families are really struggling. And we're starting to see that. We're starting to see more and more people coming and really trying to figure out how they maximize their resources. And the partnership with Astrid's team, as well as other food assistance organizations in West Hartford and the region, are critical as we move forward. The West Hartford Hunger Action Team is a group that meets monthly. It consists of town and other regional individuals who they come together and try to come up with creative ways to make sure that we are assisting our residents who are dealing with food insecurity every day. We want to make sure that families have access, and that includes SNAP, and a lot of times Astrid's staff is able to help families with SNAP applications, and then but also with respect to the food pantry, being able to give somebody a bag of food so that they have that right away. One of the challenges, however, is that 2/3 of the bags that we used to give out was through our self-select program. And this is a program where people would be able to come in and select their own food. The benefit of that program is that people are picking the food that they know their families will eat. And we know West Hartford is diverse culturally, religious preferences, not preferences, but affiliations, and also dietary preferences. We aren't able to do that as much now. So we are giving out food to people, hoping that they're going to be able to eat most of it. We are hoping to try to come up with some creative options, having more vegetarian bags. We're putting together low sodium bags because we know that there are many needs in this community. And working with other community partners, we're hoping to really create that safety net for people who really need it. I also just want to bring up programming at Hannock. So the building has been closed, although we do have someone that goes there, as I mentioned, and to deliver programs outside. But one of the things I wanted to mention is that the Bridge typically holds their youth program there once a week. And they've been really creative. They reached out to parents, and they're doing them virtually now. So they just finished an elementary girls group, I believe, and they're going to be starting a middle school group in June. And that may be how we need to continue to make sure that we are connected to our middle school and elementary kids in the Hillcrest neighborhood. I also just want to mention that, we want to go forward with all these nutrition programs, but it is important that we're sharing resources. So many of our partners have given us their information and we've given them theirs, so that when someone comes to our pantry, we're able to give them a variety of resources, including letting them know that they should reach out to 211 if they need additional assistance. So I think that's it, unless anyone has any questions.
Thank you so much, and thank you so much for all the work that you are doing. You are, feeding people during this time is so important. We have so many people that are just their lives have been turned upside down, and you guys are, just really making a difference in just functioning and living right now. And it's super important that we continue to keep an eye on that and see how it changes, because there doesn't seem to be a very close near in sight in regards to how this is going to impact on the economy, and that's going to ripple down to you. But what you did create was a really good segue of how you're interacting with the Bridge. And so I will once again try to hand this over to Chris and Jonathan.
Thank you, Councilor Sweeney, and thank you to everybody for having us and having the Bridge be part of this really important discussion. We're really grateful to be part of this community and part of helping the community to sort of stay on its feet. Looking at the time, I'll try to be really quick, and anybody who works with me regularly knows that that's not my strong suit. So I'm going to try to give a pretty broad overview. So if you're not familiar with the Bridge, we have residential programs in the region. But right here in West Hartford, we have an outpatient clinic. We do a lot of work with therapy and mentoring in the schools. This year, we were in almost every school building. We also have a family resource center that is at the Charter Oak School. and we work at Elmwood Community Center to operate the teen center, which is really John's sort of bread and butter. In sort of the post-closure reality, the clinics and my team of therapists and mentors were able to really quickly pivot to entirely virtual therapy and mentoring sessions. The clinic and the school-based counselors have been coming up with really creative ways to engage typically resistant clients in therapy and really help them to make sense of the world around them. We're seeing a real increase in anxiety and confusion with all of the kids that we're encountering, and we're just trying to help them make sense of that. In terms of the teen center, our priority was really to try to keep kids and youth engaged and connected. And John and his team were able to take a look at, who were our regular users, and we've reached out to them on a weekly, bi-weekly, or monthly basis, depending on sort of the family's level of need, just to kind of get an assessment. How are they doing? What's happening? I'll let John talk a little bit about what he's seen with that. But I think I've been really impressed with the response that we've gotten from the families. They're happy to hear from us. They're happy to stay engaged. In terms of teen center programming, we also shifted that to virtual programming. We've been doing Zoom groups. We've had a girls group, a book club, a gaming group. We've been posting fitness challenges and arts and wellness challenges on our Instagram page. And we've had some decent engagement with that with the kids as well. As we look forward to the summer, hearing all of the barriers to in-person camp programming really highlights the need that we're going to have to continually assess and adjust as to what we're doing. But we're looking forward to continuing our virtual presence, but also to, we're exploring different ways of engaging in small groups with our kids to have, our positive youth development programs continue the way that they would normally in a summer, only in an alternate format. I do want to give John an opportunity to talk a little bit about kind of what he's seen in terms of what the kids are facing as he's been working with them and his team has been working with them. So unless anybody has questions for me about the work that we've been doing, I'll sort of cede the floor.
All right, thanks, Chris. Thanks, Councilman Sweeney. Thank you to the council for allowing us the space to kind of speak about our programs. So a little bit about the state of mentoring. So I oversee the mentoring programs in the schools for the Bridge, and we have 5 mentors that have been out for the last year, working with 30 youths in all the schools. And during mid-March, we had to really about face and switch everything to virtual, as Chris spoke to. In our busiest month in February, we had about 86 mentoring sessions serving 30 youths, and then through March and April, the numbers dipped drastically. We had about 49 virtual sessions in April, and served 15 youths. And that's kind of a trend I've seen in attending the Governor's Prevention Partnership webinars on mentoring in the state of Connecticut. And there's been widespread issues of just connecting with families in general, connecting with kids who are at risk or who are needing services. It's been a big challenge, but we were able to kind of meet a lot of those kids where they're at virtually, and so that was a big success for us. I'll speak a little bit about the state of the teen center youth and some of their peers. I just got out of a leadership meeting with them today. We have the leadership meeting every Wednesday as part of our continuing virtual services. And a lot of the kids are talking about their friends struggling with mental health in general and concerns with regards specifically to depression and anxiety. We've had some teens during these, positive youth development groups. We're not support groups at all. We don't have therapists. We have youth counselors and myself working these groups, and a lot of the teens are having significant struggles. We've had specific teens break down in these meetings. We've had to reconnect with them after the meeting to make sure they're okay. They're having, normal difficult stressors, which are becoming even more difficult under the circumstances of being isolated and alone. So we're able to kind of gather those teens and still, keep them connected. Chris talked about our virtual groups that we've been offering. I'm sorry for that kind of, dark look into the teen center, but we do have a lot of positive things going on. We have a movie group, like Chris said, on Mondays, 2:30 to 3:30. We have a girls group on Wednesday, 2 to 3 o'clock. Our leadership group is strong with 14 members. We are held every Wednesday, 3:30 to 4:30, and that focuses on leadership development, guest speakers, community projects, services, and fundraising. We have a book club on Thursdays from 2:30 to 3:30, and then a game group again on Fridays, 3 to 4:30. I've developed a list of 65 families that have, we've deemed Teen Center regulars, and we've been conducting bi-weekly check-ins to assess the needs of those families. And out of those types of things, we've had, referrals to these groups. We've had families kind of reach out with, food insecurities, and so we've tried to, provide those families with some gift cards to grocery stores to kind of meet those needs for those families. A look ahead to our summer. I know that things will be different from our previous years and summer programming, but I do look to what we can do and kind of be a solution focused person. We have like a bright future in the summer this summer. We have our continuing gardening project from last year where we built raised beds at the Elmwood Community Center. We're going to be partnering with a 4-H master gardener, whether that be virtually or in small groups, looking to teach kids how to compost, care, harvest fruits and vegetables and herbs. We're going to be continuing holding food drives and special item drives for the food pantries in connection with the food pantry at West Hartford. We're looking to do a spread the love campaign, which is a bit like the flocking for SafeGrad, but allowing neighbors and town members to show other neighbors that they're cared for by basically flooding their lawns with hearts or other messages that the teens can kind of provide with delivering. We're looking into developing a possible Got Lunch program to purchase, prepare, and deliver lunches to those families in the community who struggle with food insecurity during the summer with no access to school lunches. We know that's going to be a big issue. So we're looking to kind of fill that need as well with the teen volunteers. We're also going to be adding additional one-on-one mentoring or small group mentoring, depending on the restrictions. And then looking again to expand our virtual social distance meetings, including talent nights. We used to hold one teen night per month, which was a big event for teens, but we're going to hopefully switch that virtually to talent nights, where teens can come perform singing, musical instruments, rapping, spoken word, etc. We're looking to open up an LGBTQ safe space, which is youth-led. It'll be staff monitored, but also partnering hopefully with True Colors around that and figuring out how that's going to work. We have a big proportion of our leadership group identify on the LGBTQ spectrum, and they're not able to connect with their GSAs at the schools, which have been shut down. So that's something we're looking to provide. Also a cooking club, an arts and activities group, a creative writing group, and a photography group. So I realize that we're way out of time, and I appreciate the time that we've been allowed to speak today. Thank you.
I'm sorry that we had a lot of our really essential services at the back end of this, because between Ashley, Suzanne, and the bridge, you guys are dealing with kids right now and meeting them where they are, and I think as we talked about earlier in this, I think this will lead to several other breakout conversations where we can really kind of hone in on it. Again, Jonathan, what I really appreciate about what you brought forward is acknowledging that there are some issues here, but you are also looking at the positives here, what we can do, and I think that's the new COVID world, right? Is like acknowledging what is screwed up and figuring out a way to get through it, and that's just kind of what we have to do right now, and that was a really nice way to kind of move forward here. I will open it up to questions here. If anyone else has any questions for any of the speakers here. All right. I will move on to Mr. Hart. If you have you have community partnerships.
Oh, Matt Hart. Thank you, Councilor Sweeney. Ms. Oslander covered that item.
You're on mute.
Mayor Cantor talked about the next scheduling of meetings, so we will talk about that. And then, as I said at the beginning, Councilor Fay, the mayor, and Councilor Blanks and I will kind of talk about how we organize these next meetings going out so that they aren't 3 hours, and so that we can specify the content and just really be more focused. And I apologize. I know that everyone is home with their families, and I'm sorry that this took 3 hours, but I learned a lot tonight. And I just really do appreciate everyone's time. Everyone here who talked tonight is really changing the lives of people on a day-to-day basis, and that there's so many people in town that are personally thankful to folks that are here, that you have really changed their lives. So I appreciate what you guys are doing. And Mayor Cantor, I don't know if you have anything to wrap up with.
Yes, I'm waiting for my husband to finish washing the dishes. This is a unique event, so I know I'm teasing. I'm like, stop on the water. So I just, of course, this is too much wonderful information and too short a time. And this was backed up a bit. You know, there's been so much to deal with. We actually had to get through the budget before we could do some other things. So I apologize to everybody for having this such a long night, but everything that was said is so important. And I just want to, I mean, what we've heard is the tapestry of what makes our community work and what makes us so special. And from every different angle. So each one of you in your Brady Bunch box, thank you so much for everything that you do. You know, and all of you. And I don't want to take too much more time, except that we were catching up on some things, and going forward, we'll be more strategic. We have a meeting scheduled for for Thursday, a week from tomorrow, for the economic group advisory committee, and Leon is chairing. And then we will be the following Monday, June 1st, we will start with this meeting again, and we will go every Monday at 6 p.m. So it will be a standing time, and it will be, hopefully we can keep to 2 hours. I think that would be a good length of time. And if we can tell people when they need to be, that might be helpful as well. So you don't have to be on for the whole period of time. If there's something that interests you, that is, you know, that we want you to engage. So right now, I think we've had a broad stroke and a broad picture of all that of so many of the services that are in our town, and then the bridge is part of our town. It's it's a contracted service. So, and now we need to create those connections. We need to support them, and then we need to create the connections to identify needs and how we can help as elected officials, and how the community can continue to help. So again, thank you all for everything you do every day. When we talk about essential workers, a lot of times you're not included in that description, and that is wrong, because you are essential, you're frontline, and you're needed in everything. And not only have you made lives better, you've saved lives. There's no question. So again, thank you so much for all that you do. Back to you, Liam.
Unless anyone has anything to offer, I will make a motion to adjourn and allow everyone to eat dinner.
I don't think you need a second. I think we're all set. Thanks so much.
Thank you, everyone.
Bye.
Thank you, everybody.